let's say you're dealing with a patient in the medical surgical unit, and this patient complains of increasing pain, and the question states, what is the nurse priority action? So this is an excellent scenario. So what are some keywords here? The patient is complaining of increasing pain. And here are some questions that you should be asking. Well, what did the pain increase to, and what did the pain increase from? See, in this scenario, you don't really have a lot of information. All we have is subjective information or referred information from the patient. Is this patient having a mild pain, a moderate pain, a severe pain? I do not know. Has the nurse completed an assessment? Has the nurse conducted an assessment? Described on the stem of the question? No. There is another keyword. The word increasing means a change in condition. And usually, whenever you see a change in condition, most times you have to validate because something changed and you need to validate what is going on. We see answer number 1, administer intravenous morphine. Answer number 2, notify the healthcare provider. Answer number 3, using a pain scale, identify the level of pain. And answer number 4, identify on the electronic medical record, or EMR, the last administration of pain medication. So we have several answers that we can eliminate, and I'll teach you how to use the process of elimination in this scenario. Number 1, administer intravenous morphine medication. This is an implementation. Number 2, call the doctor is an implementation. Number 3, using a pain scale, identify level of pain. This is an assessment. And number 4, identify on the EMR when was the last time the medication was administered. This is also an assessment. So right now, off the bat, I know that I can use a prioritization strategy known as the assessment versus implementation strategy. And many of you that have seen the video on the membership on the priority category, how to use the assessment versus implementation strategy, you will really understand what I'm saying here. So in this question, you can apply the assessment versus implementation strategy. And it is rather simple. Look at the question. Has the nurse conducted an assessment? No. Is this an emergency? I have no clue. What did the pain change to? If the pain was 1 and changed to 3, it's not an emergency. If the pain was 3 and it changed to 10, then yeah, we have a severe pain and we have an emergency. So this tells you that your answer is going to be an assessment. This is a scenario where I have to validate. So answer number 1, I can eliminate, and answer number 2, I can eliminate. Another reason why you can eliminate, number 1, morphine. Well, I can administer morphine in severe pain. I don't know what is the level of pain in this scenario, so I cannot just assume that the patient's pain is severe and I cannot administer that morphine IV. So I can eliminate 1. I can eliminate 2 using another strategy. They went to call the doctor strategy. Is there something that I can do? Is there something that I can do to help the patient's problem? Yes. So answer number 2 is eliminated. But now we have a problem. I see a lot of students stuck in between 3 and 4. And you see, many of you selected 3. Some of you selected 4. But the question here is, why 3 or why 4? That's called critical thinking. So what makes answer number 3 be a better answer than answer number 4? Let's go in depth in these two answers. Because the ability to pass the NCLEX or not lays here. Whenever you're stuck in between two answers, which happens pretty often, the student that passed the NCLEX is the one that has the capacity to select the right answer more often. So you need to pause here and say, why is 3 the answer and why I can eliminate 4, or vice versa? Why is 4 the answer and I can eliminate 3? Answer number 3 says, using a pain scale, identify the level of pain. Identify what? The patient's level of pain. So answer number 3 is an assessment that I am doing with the patient. I am including the patient in this answer. Identify the level of pain. Patient, what is your level of pain? 0 to 10, 1 to 10. What is it? Identify the quality of the pain. Is the pain radiating anywhere? These are important questions to ask. So if you have an answer that includes the patient in the assessment, this is a very good answer. Why? Why is that a very good answer? Because, one, it includes the patient and the patient feels comfortable being part of the treatment. His input is important. So that is one reason. Another reason, it validates the patient's problem. It validates the scenario described on the question. So if you really take this into consideration, answer number 2 is better. It is a better assessment because it focuses on the patient and the patient's problem, and more importantly, it validates the subjective data or the referred data described on the question itself. So why is 4 not a better answer? Because answer number 4 focuses on the patient's chart, not the patient's problem. The chart, when was the last time that medication was given? And you may say, but that is important. I need to know when was the last time the medication was given. Because if I have a medication that says give morphine PRN Q4 hours and 4 hours hasn't passed by yet, maybe I have to call the doctor again and request another medication. Maybe that is important to tell the doctor, whatever medication we're giving is not sufficient. So number 4 is not that it's not important. It's extremely important. It is not the priority. That is the difference. So you need to take that thinking process that you're looking only for the right answer. In prioritization style questions, you're looking for the most important answer because you could see more than one answer that is correct. The answer for this question is answer number 3. It is the nurse's responsibility before administering medication to really understand what is going on, to really understand the reason why the nurse is giving a medication. What is the patient's response? What is the potential adverse effect, drug interaction?